Hey Omega Ninjas, so now it's time to do some foam roller. Now, you don't know what a foam roller is? Not rocket science. It's first started as a piece of foam in a roll. Okay, so you can go to Walmart, Amazon, whatever, go pick up one of these bad boys. Now, personally, if you're beginning, might not be a bad idea for you to get one of these. It's nice, it's easy, it's cheap. Okay, but they do get soft and warpy and stuff like that. Doesn't really want to roll the way it's supposed to. So what I typically have my patients do is get one like this. It's pretty much a PVC pipe wrapped in dense foam, so it should never break down. Okay, so that's what we're going to use today. What we're going to do is we're going to have Haley work on the big three, is what I call it: hips, spine, shoulder curl. So the first thing you're going to do is you're going to sit on it. Okay, now just pick a leg. You're going to cross one leg over the other one, and then whatever leg you have crossed, you're going to lean to that side. And then what I do is you just roll up and down on that butt cheek, and the rolling part is a scan. Now the first 2 weeks of this, typically pretty painful, so just do what you can do, okay? You might have to just roll up a few times and then move on. But the more you do this, and the better you can tolerate it. It's not hurting so bad all the time. I want you to roll and you scan. So when you scan that area, stop where you feel a little trigger point. And when you stop, move that knee up and down, sit there and kind of dig that trigger point out of there. Okay? Now just sit there and work it out till it goes away. At first, it might not go away. Okay? Then whenever you go to the other side, what you do is you cross the other leg. A lot of people want to cross the same leg. Try and do that, okay? Same thing. Take your time, do your scan. You can roll in the same spot. You can lean a little bit more to the side. You can go a little bit higher up on the pelvis. Find out where you have your trigger points out and work them, okay? Now, a lot of times it's like, oh, how long will it take before it's not killing you? 2 weeks is kind of like the normal window, okay? And some people want to know, how long should you do this? I tell people it's kind of like a bell curve. At first, when you're first doing this, it hurts quite a bit, so you don't have to do it for very long. Then you can start tolerating it, then you do it for a little bit longer, because then you're starting to see the benefit of it. You're like, man, I feel really good after doing this. But after you start working some stuff out, you don't have to do it as long because the knots go away faster. Okay, so it's not a very direct answer. It's kind of based on you. So then after you're done working on the hips, what you're going to do is you're going to roll your body down to the ground, and you're going to put it between your shoulder blades. Okay? When you're here, support the head. Pick your butt up off the ground. And then now what you're going to do is roll up and down the spine. Now for you ladies or people who have long hair, do something with it. Put it in a bun, put a hat on, do something, roll it up, because if not, you roll over your hair, it won't feel very good, okay? So you see how Haley is extending back? A lot of people want to sit there and round at the same time. We're actually trying to stop that rounded, hunched over position. We want to cause some thoracic spine extension, okay? So I always tell people, think of this as like a tank rolling over like a log. What it does is it kind of rolls over it. You should have that spinal mobility in anywhere in your spine, okay? Now, once you've kind of gone up and down, oh yeah, what not to do. Don't go toward a lumbar spine. So once you get to about like right here, stop. Just kind of work on this top part. But whenever you're done, put your butt on the ground. So you got your supporting your head. What I want you to do is I want you to extend back, breathe in, come back up, breathe out. So what you're doing is we're going to try to move one vertebrae at a time, right where that foam roller is hinging. So you're just trying to get some motion through there. So when Haley's done, when she feels like, that one's pretty good, she's going to roll down to the next segment and move that one also. Just sit there and work slowly all the way down to that mid back. Sometimes you might feel like, I'm good, and you get to one segment that is just, you can tell it's not moving. Sit there, camp out on it. Let your body kind of relax into it. You can even extend and just work on your breathing techniques. Okay? Now, last but not least, we're going to work that pesky shoulder blade area. So what you're going to do is say right there in the middle part of the spine, you're going to roll over just a little bit. We want to get right on that inside edge of that shoulder blade. So you're going to bring your arm across your chest, lean to the side, there you go, that you have your arm crossed, and then you're just going to roll up and down. It's not very far, it's only a few inches, but you'll find a few little knots in there. Same thing, stop on it if you can, sit there and kind of move that arm around, dig that little trigger point out of there. Okay, remember to breathe and take your time. Have fun. All right, so now we're going to talk about sitting posture. So we know everyone just kind of plops down on a desk and gets to work. Now you see how Haley's slumped over in like a C-shaped position? You ever wonder why at the end of the day your neck starts hurting, shoulder starts hurting, got a little headache here or there? Well, that's because the posture is all affected. So how can we fix that? Well, what we're going to do is we're going to start with the pelvis. So what we're going to have Haley do is lean forward. She's going to put her butt all the way to the back of the chair, and then she's going to take a towel, a pillow, a rolled up jacket, something, and just put it between her, like right at the bottom part of her shoulder blades. Not really the lower back, in the shoulder blades. And then whenever she sits up, it's going to allow her to sit with her ears directly over her shoulders and her shoulders right over her pelvis. And then whenever she has an outstretched arm, you want to have the elbows as close to the side as you can and have your mouse hand not really far out in front of you, but kind of in a neutral position. Okay. Now in this example, the computer is lower. You would want to raise the computer to an eye level position so the person is not looking down. All right, or you could get a standing workstation. So with this, you want to try to make sure, of course, your computer monitor is eye level and that this part of it is almost relaxed and just here, not up like this or not way down low. You want this part of the desk to be normal and relaxed, okay? Same thing, I don't want my shoulders right here kind of slumping like a lot of people do. You want to try to neutral posture, okay? Sometimes everyone wants to try to lean on this desk and kind of have their hips all like that. If you can, think of it an A-frame, like a sandwich board. Stand a little bit wider, tuck the pelvis, engage the core, and try to see if you can stand like that for a little bit. Okay, so everyone wants to know how to stand. A lot of people, when I take postural pictures, of course everyone kind of like slumps up here. But what is this pelvis legs doing? For some reason, everyone kind of like their pelvis leans forward, causes that anterior pelvic tilt or a shift, then they arch their back, and then their head goes forward to compensate for it. Everyone's hamstrings are always tight, calves are tight, and back is compressed. So what I want you to do is kind of spread your legs, feet directly underneath you, and then what I'm going to have you do is just look between your legs just a little bit. You see how when I do that, my hips kind of set back over my heels? Then what I'm going to do is keep my core a slight contraction, and then try to see if I can come back up without arching the back. So look between the legs, tuck the butt a little bit, contract the core, and try to center yourself. Most of the weight should be at your heels. Then if you can, shoulders back, chin down, head and back. We'll talk about this more in detail with the posture series, but this is kind of how you should be standing. Nice and firm with weight on your heels.